stand on that too. So Arun, that was great, and I am really, it's wonderful to see what the foundation does for these students and residents. And so it's good for me to have this opportunity to tell you some about my dad. So I had a pause, I'll tell you, relative to President Mundy's presentation and thinking about planning last year's meeting. He wanted me to give the address and you did a wonderful job, but you made me stop and pause. And that was really the message of savor those family moments. That was great. And I'll tell you that this is a picture that my sister sent to me recently. It's about a year ago in my father's study. And you can see all the books. He's an avid reader. And I was trying to convince him to come here and enjoy this meeting because we're such a great group and talk about how the vascular evolved through the state of Georgia. And I didn't want to get him on the golf course. Well, the moment passed, the meeting was canceled, and Dad died about 6 months ago. So now I'll tell you about it. I'll tell you a brief history and then sort of tell you how he impacted things. He was born in 1934. He actually started Emory University when a relatively young age at 15, and he graduated in 1954. He started Emory at Oxford, then went to Maine Emory, where he finished, and then started medical school in 1954. He was married during his second year of medical school, graduated and stayed in town and went to Grady. This is when Grady was separate from Emory, so they were not a combined program. But he did his 5-year program and finished in 1963. If you remember the math, that was an important year. You thought I was the tough guy. Look at that, right? He served after he finished training. He was on the Berry Plan and went to Air Force, Mountain Home Air Force Base in Idaho, served for 2 years. After those 2 years, this is his quick professional history. He came back for a fellowship. So this was 1965 to 67. And some of you will recognize the name Harold Harrison. His name adorns a large building in Augusta at the Medical College. After he had 2 years there, he then went to private practice for over 30 years. Even after he finished private practice, he was very much professionally active, not clinically, but involved really with advancing medicine, not really in the vascular world, but in general medicine. And that was with the Association of American Physicians and Surgeons. Now to tell you a couple of his other highlights. 1965, he returned with a full quiver, as we say. And you can see he was quite eager to learn about vascular treatment. And at the time, this is when vascular was mixed with cardiac, mixed with general. So he had to limit and declare a limit in vascular surgery in that early time. That's really how you got endorsement from the rest of the community. But you had to travel around the area really to build up the business because it wasn't really the area where you would have just vascular focus or just a vascular only treatment. And I think he was also motivated by these 6 children. And you might want to guess which one I am. I'm that innocent cherub there in the middle, in case you're wondering, the youngest of them all. Excuse me, go. Oh, no, can you go back one for me, please? The delay caught me. One more. Good. Hit it one more time. That's a movie. Thank you. So he did very much have interest in the technical parts of vascular surgery. That's supposed to be a video, see if you can hit it, because he actually recorded this operation. It's a superficial femoral endarterectomy, a complete long incision, 1967. So you think the atherectomy is new? No, it's old. It's simply miniaturized is what it is. So it's the same thing that they were doing years ago, just a different technology. See if we can get it to play. It was playing shortly. Anyway, he was recording the video. I think it was Dr. Harrison operating. And as I told you, he had to travel around the metro area. And this was very much the practice of the time. And to put it in perspective, it's the people at Emory at the time who were establishing vascular surgery as a separate discipline were really Garland Perdue and Bob Smith. We've already honored Dr. Smith in the earlier presentation. He eventually concentrated his practice at Piedmont Hospital, now Piedmont Atlanta, and DeKalb General, which is now Emory Decatur. So he did move around, but eventually concentrated, and that's where he worked until 99. And there are some nurses and other support staff who still know of him and speak of him at those sites. Now, work-life balance was not in the vocabulary through his era in the 70s and 80s, But he did have some outside interests, and I mentioned some of his political interests, mainly towards the practice of medicine. But he also had some other adventures. Occasionally, he would get out on a sailboat with a local competitor, Dr. Doug Whitney. If you don't recognize the name, this is the father of Brooks and Glenn Whitney, who also practice in the state in various locations. And this is a famed photograph that hangs on his office wall, where they were at a regatta at Lake Lanier. And there was another new sailor who was proud of his accomplishments. That was the media mogul, Ted Turner, before he was a media mogul. And they were proud because Whitney and Dad beat Lanier in this race. So you can have outside interest. Now, I don't know who that poor soul who's sitting on the starboard side up there, it looks like he's about to jump overboard, but clearly some concern when you're out there. So you can have some work-life balance. I hit it. I got it. So I really think his primary focus outside of medicine or outside of vascular surgery was his advocacy for private practice. And this is where he was so active in AAPS. And he actually rose to the ranks of president of that society. And here he is addressing the group at their national meeting in 1979. He was also president of the Atlanta Vascular Society. This is when I was doing my fellowship at Emory at the time. This Atlanta Vascular Society would meet only in Atlanta, but it was really through some of the insight and the advocacy of people like Dr. Kirkland, who got Atlanta really morphed to Georgia Vascular. And so you need to thank some of those people who helped promote this. And again, Dad's primary focus was promoting the doctor-patient relationship, even to the extent, Dr. Tracy, you might appreciate this, when Medicare came along and wanted people to assign their patients to assign benefits so the doctor would directly bill Medicare. Dad didn't want to do that. He wanted to only contract with the patient. And then he would help the patient then send that bill on to Medicare. A very different practice, obviously not very popular in today's environment. His political activism kept him involved, engaged, and here he was in the 70s. And he did get to meet other folks as he would have them at some various medical meetings. He inspired students, residents, and fellows, even when he was at Piedmont, Atlanta, that there would be Emory residents that would rotate there. And again, he was constantly advocating for the independent nature of medicine. And he had a singular focus of treating the vascular patient. And this was also different at the time. This was the 60s and 70s. After his retirement, this is in the 2000s, he continued independent thought even when it was counter to mainstream. He was relatively balanced in some of his expression, but he still inspired me and inspired a lot of others. And I can tell you that absolutely he would be honored to have his name supporting this best medical student presentation each year. So lastly, I do want to extend a heartfelt thanks to the Georgia Vascular Foundation, to the Executive Council of the Georgia Vascular Society, with the real intent that the establishment of this award will continue to instill passion for vascular surgery for the medical students, for the residents, and also keeping that primary focus on that doctor-patient relationship for future generations. Thank you, Arun. I very much appreciate this honor.